Ankylosing spondylitis. Ankylosing spondylitis gets its name from the Greek words ankylos, which means bent, spondylos, which means spine, and itis, which means inflammation. Ankylosing spondylitis is a chronic inflammatory autoimmune disease of the spine that affects mostly the lumbar spine and sacroiliac joints, but can affect up through the thoracic spine. Symptoms of ankylosing spondylitis include a deep pain in the buttock region, low pain that is stiff and painful but ease with movement. Usually this is worse first thing in the morning. Easy fatigue, GI-related issues such as Crohn's or ulcerative colitis. It can cause genital lesions or also Raynaud's phenomenon, which is white or blue fingertips with numbness in the cold. Dan Reynolds of Imagine Dragons is one person of 1% of the population that suffers from AS. AS affects people between the ages of 17 and 50, and usually more men than women are diagnosed. If a patient is suspected to have AS, a doctor will do a full examination checking for spine mobility along with certain pain and tenderness spots. An X-ray and possible MRI of the sacroiliac joints will be taken. Certain blood tests can also help determine if a patient has ankylosing spondylitis. These blood tests include an ANA, which is an anti-nuclear antibody, which checks for the presence of an autoimmune disorder, HLA-B27, which is the AS gene indicator, an elevated erythrocyte sedimentation rate, and C-reactive protein can show inflammation. Your doctor may also check for the rheumatoid factor to rule out rheumatoid arthritis. As typical with most autoimmune disorders, it takes 1 to 3 years and up to 5 doctors, including a rheumatologist, to diagnose ankylosing spondylitis. Treatments for AS include NSAIDs such as Celebrex to help inflammation, biologics such as Humira that inhibit the tumor necrosis factor, which also inhibits inflammation, IL-17 inhibitors like Cosentyx, which inhibit T-cell lymphocytes from attacking, and a hip replacement if necessary. Physical activity such as walking, swimming, water therapy, yoga, daily stretches, and cycling may help ease the stiffness and pain of ankylosing spondylitis.